Chapter 7: Government Mandated Social Security Programs. Learning Objectives: Origins and Introduction of the Social Security Programs, Structure of the OASDI program, the structure of the Medicare programs, financing of OASDI and Medicare programs, and lastly, unemployment insurance programs. The origins of the Social Security program. During the Great Depression of the 1930s, the Social Security program made it possible for people that were unemployed, injured, and elderly to buy food, clothing, and other necessities. The Social Security Act of 1935 and subsequent amendments established 4 public social insurance programs: the Old Age Survivor and Disability Insurance, which is known as OASDI, secondly, Medicare, third, unemployment insurance, and fourth, the Supplemental Security Income Benefits. The Social Security Act set up 2 programs: a federal system of income benefits for retired workers and a system of unemployment insurance administered by the federal government and state governments. In 1939, there was an amendment to the Social Security Act that established the Survivors Insurance Benefit, and in 1965, an amendment that established the Disability Insurance Program and Medicare program. The origins of Social Security. The Social Security Act set up 2 programs: a federal system of income benefits for retired workers and a system of unemployment insurance administered by the federal government and state governments. Employers are required to participate in a Social Security program. However, the coverage rules are different for OASDI, Medicare, and unemployment insurance programs. The 2 federal agencies that primarily oversee Social Security programs are the Social Security Administration and the Centers for Medicare and Medicaid Services. The Social Security Administration provides the federal retirement for survivors and disability insurance programs, as well as supplemental security income, also known as SSI, for the aged, blind, and the disabled. Titles 3 and Title 9 of the Social Security Act authorized the federal government to grant money to states in order to provide unemployment compensation and set up Federal Unemployment Insurance Trust Fund. The Employment and Training Administration in the United States Department of Labor oversees unemployment insurance programs. Origins of the Social Security number system. The Social Security Act authorized the creation of a record-keeping system in order to monitor and record employees' wages. By tracking employees' wages, the Social Security Act would then be able to use that information to determine the amount of employee benefits to provide under the OASDI and unemployment insurance programs. Through this authorization of the record-keeping system, the creation of the 9-digit Social Security number occurred. Once the Social Security number was created in the late 1930s, the Social Security Administration began issuing numbers to U.S. citizens, foreign students, and resident aliens for a variety of reasons. The structure of the OASDI program. The OASDI program means the Old Age Survivor and Disability Insurance Program, which has two additional benefits that were established by the amendments to the Social Security Act in 1935. The Social Security Administration uses a system of Social Security credits to identify if an individual is eligible for OASDI and Medicare benefits. Employees accumulate credits based on their payments of Social Security taxes, which is withheld by their employers from their paychecks. An employee must earn 40 credits to be eligible to receive retirement benefits. Employees do not forfeit credits when they change jobs or become unemployed. Old age survivors' disability insurance is one of the most significant parts of the Social Security disability program. It is designed to ensure continuing income for those who are retired, surviving spouses, and dependent children of workers who have died and those who qualify for Social Security disability. More information on the structure of the OASDI program consists of information regarding the number of credits needed to participate in the old age program, and apparently it is dependent upon the individual's year of birth. If an individual was born after the year 1929, then that person would require 40 credits in order to participate in the old age program. Once the required minimum credits have been acquired, the individual becomes fully insured for life. After an individual becomes fully insured, that individual must meet the age criteria before receiving benefits. The structure of the Medicare programs. Medicare programs serve U.S. citizens aged 65 or older by providing insurance coverage for hospitalization, convalescent care, and doctor's bills. In order to qualify for Medicare benefits, individuals that are 65 years of age or older and have earned 40 credits are eligible to receive Medicare benefits, and coverage automatically extends to spouses of eligible individuals. Family members with disabilities are eligible to receive Medicare benefits, and younger individuals qualify for Medicare protection if they are deemed seriously disabled for a period of at least 24 months. The ABCs of Medicare. Part A of the Medicare program covers inpatient hospital stays, skilled nursing facility stays, some health visits, and hospice care. Part B of the Medicare program covers physician visits, outpatient services, preventive services, and some home health visits. Part C of the Medicare program refers to the Medicare Advantage program through which beneficiaries can enroll in a private health plan. And lastly, Part D of the Medicare program covers outpatient prescription drugs through private plans that contract with Medicare. Financing of OASDI and Medicare programs. Financing for OASDI and Medicare programs require equal employer and employee contributions. The Federal Insurance Contributions Act, also known as FICA, requires that an employer pay tax based on its payroll and employees contribute tax based on earnings. The Self-Employment Contribution Act, also known as SEC, requires self-employed individuals to contribute to the OASDI Medicare programs, but at a different tax rate. The largest portion contributed to the FICA, which is the Federal Insurance Contributions Act, is used to fund the OASDI programs. Viability of the OASDI and Medicare programs requires sufficient funding to cover current and future beneficiaries. Unemployment insurance programs. The National Federal State Unemployment Insurance Program issues weekly income to individuals who have become unemployed through no fault of their own, and it is administered by each state through their own program, which they have developed guidelines and parameters set by the federal government. States pay into a central unemployment tax fund, which is administered by the federal government and then invested by the federal government and dispersed to the states as needed. In order to qualify for unemployment insurance benefits, individuals must meet several criteria. Unemployment alone does not necessarily qualify an individual for these benefits. Some of the requirements are limited voluntary unemployment and involuntary unemployment, except for disqualifying cases, a minimum earnings and employment requirements. A waiting period is required in most states. A capacity to work and an availability for work. Lastly, active seeking of suitable work during periods of unemployment. In summary, this chapter introduced the fundamental concepts of the Social Security and Workers' Compensation programs. Social maladies of the 19th century gave rise to the Social Security and Worker Compensation programs, and the programs reviewed in this chapter interface with the variety of tax regulations and employment laws and require mandatory employee contributions and employer contributions for sustainability.